63 minutes. Again, an hour and 3 minutes. It's not very long at all. Ideally, people are going in for a regular primary care checkup on a regular basis. More and more adults have multiple chronic diseases, and so they're either going into their primary care doc to get their diabetes or their hypertension or maybe their heart failure managed. But so many obviously require specialists for their chronic kidney disease and seeing the nephrologist, or for their heart disease and seeing the cardiologist. Again, even with all of that, the most adults, again, on average, are only spending an hour there. It's such a small amount of time. And part of that is, I think, the continued pressure on provider organizations that, frankly, have less and less time for an individual visit with a person, right? And any of us who've gone to the doctor in the last number of years, you realize how short that time is, right? It's an in and out experience. And what that means, too, is that physicians, clinicians, NPs, PAs have less and less time to gather and synthesize, analyze data outside of what's right in front of them, thinking about the person and their diabetes and are on the right treatment plan and on the right drug. Yet, what we know, if we looked at 1,000 individuals who all had diabetes, they all would have so many other life challenges. Some of them would have incredible support around them, and maybe a spouse, loved one, family who helped with their medications, helped make sure that they followed a treatment plan, helped get them to the doctor, reminded them to eat well, which is amazing. But there are also going to be a lot of people, right, who are struggling, right, either fully struggling and in need and don't have transportation, right, or can't afford, right, healthy food options, or can't afford the copay on their prescriptions, or just have trouble navigating all of the different steps in their treatment plan. And yet on the clinical side, we treat them all the same. And so what we know from the data is that those individuals that have those barriers, that have those challenges, their outcome, their health is worse.